I spent $20,000 on a party just to prove one point. But we'll get to that in just a moment. You see, public policies are complicated. They are full of complicated language, complicated histories, and complicated economics. And the issue that was the focus of the party is no different. The US healthcare system is largely broken. At the same time, it's a time-traveling wonder of regulatory band-aids on top of regulatory band-aids, as well as layers and layers of middlemen. It's also still one of the most innovative and best systems in the world. But how much better could it be without bad public policy? One example is that the federal government currently pays more to hospitals than it does to independent doctors for the exact same services. The hospitals claim that this overpayment is necessary for two reasons. First, they claim that hospitals are big, complicated, and expensive to run. And in some ways, of course, they're correct. However, in every other market, the bigger that a company gets, while it does get more expensive in the aggregate, the per employee expenses go down. Creating a cafeteria for one employee is much more expensive than creating a cafeteria for 1,000 employees. In fact, it's 1,000 times less expensive. That is why the prices we see at Walmart, Target, BJ's, and Costco are less expensive than at local mom and pop shops. It is like a billionaire claiming that they need to lower taxes because the overhead for their lifestyle is just too expensive. Hospitals also try to pull at the heartstrings of Congress by claiming that they need the funding in order to maintain the viability of rural hospitals. This means that they are asking Congress to put their business over the employers and employees in their districts who are also forced to pay the higher prices. But even if we take them at their word, which we shouldn't because they're still shutting down rural hospitals when they buy them, or at least shutting down many of the services that are offered, they are still asking for a generic payment distortion to be used to subsidize the rural hospitals. If rural hospitals do need assistance, and we don't think they do, or that any actual data points point to this, then the best way to fund them would be for money earmarked for rural hospitals to be a part of the federal budget. So that brings us to our party. You see, we had two separate bars at our party. One was a hospital-owned bar, which charged 10 tickets for a drink. The other bar was the independent physician bar, which only charged 1 ticket for a drink. Like any normal market, almost everyone lined up at the independent physician bar. And anyone that mistakenly went to the hospital bar either scoffed while they walked over to the other bar, or they paid and they regretted their choices. The question then is, why does Congress use taxpayer money in a way that nobody else would? Why does Congress overspend for healthcare? Hopefully this public policy dilemma is soon solved on Capitol Hill. 1 ticket drinks! Those are so loud.